MRI scans are an important tool to use when working with someone affected by MS or multiple sclerosis. The MRI scans are used to diagnose MS, to monitor the progression of this condition, and also to implement treatment. In this video, I'll talk about how MRIs are used for diagnosis of MS, and in the next video, I'll talk about how MRI scans are used to monitor the condition and choose treatments. MS is a condition that is characterized by patches of inflammation that affect the white matter in the brain and/or spinal cord. Now, the white matter acts as an insulation around the axons, and when this insulation doesn't work properly, the axon can't work properly either. This leads to some symptoms, clinical presentation that is the first point in which MS is suspected. So clinical diagnosis of MS is essential in every single case. There's two other tools that can help the diagnosis of MS, and that's MRI scans. And in the MRI scans, you can see the active plaques, the active patches of inflammation. And you can also see the patches or the plaques that used to be active and are not active anymore. Lumbar puncture is used to draw CSF from the lumbar spine. The CSF circulates around the brain and the spinal cord, and if someone is affected by MS, the CSF contains antibodies called oligoclonal bands, or for short OCBs, that indicates an autoimmune inflammatory process, which is what MS is about. For MS to be diagnosed, active inflammation had to happen at least at 2 different times and at least in 2 different locations, hence the name multiple sclerosis. The McDonald criteria are the criteria the doctors are using to diagnose MS. And in these criteria, they describe the various combinations of findings that fulfill the criteria for 2 different times in 2 different locations. And I'll give you an example. Someone might be coming to the clinic with MS symptoms. Clinical examination suggests that there is MS. And when the neurologist looks at the MRI scans, they see that except for the active inflammation that is happening at the moment, there was another active inflammation in the past. And based on the MRI scan, they can diagnose the MS because they see that something like that happened in the past. I hope you now understand why MRIs are so important for the diagnosis of MS. If you want to learn more about how brain imaging can be used in rehab, head to my website to find out about courses and consultations. See you in the next video.